Hello. This is Glenee. I am the visionary founder and CEO at Glenee's RX for Life, where we specialize in career burnout and workplace healthcare education. We specialize in workplace mental health, providing specialized knowledge, understanding, and application for Black career women and registered nurses' unique mental health needs in the workplace. Today, I want to talk to you about where are my notes? Today, what your employer is required to tell you about FMLA and what no one tells you about what happens next. As your workforce care nurse, I need you to know something very important that most employees don't learn about FMLA until they're already overwhelmed, exhausted, crying in the parking lot, having panic attacks, can't sleep, can't focus, and are considering quitting. By then, you're already hurt. It doesn't have to be that way. So, I want to go over a few points with you. Point number one, you don't have to say FMLA. If you tell your employer you need time off for a serious health condition, they should begin looking at whether FMLA applies for your situation. Many workers don't know this. Even as a practicing registered nurse, I have done cardiac catheterization procedures on patients who just found out that their widowmaker, one of the most prominent vessels inside of the heart that supplies blood, was 40% occluded. We open it up, make an appointment for them to come back and get the rest of the vessels done. And the first thing they say to me is, Nurse, when can I go back to work? And it's not always about them missing money. Sometimes it's about them not knowing that they can take a protected leave off. Now, while I do want to focus sometimes on helping people with physical ailments understand how to use FMLA, my primary focus is mental health because when you're dealing with workplace mental health, the condition and the situation is not always you. Many times it's the workplace that's causing it. And so we want to make sure that we're completely focused on what it is that you need to have healthy mental health and wellness in the workplace. So, point number one is that you don't have to say FMLA. Point number two, FMLA is often the entry point. This is where my teachings differ from anyone else on the internet, anyone else at the doctors that you may be going to. Most people think getting approved for FMLA solves their problems, but it doesn't. FMLA is the entry point to a much larger system involving human resources. You've heard HR is not your friend, disability, psychiatry, therapy, ADA accommodations, and return to work decisions and strategies. This is where Black career women and registered nurses can get lost in the shuffle, can get misguided and misdirected, where they lose language, where they lose understanding, focus, and health equity goals that they should be meeting for themselves. Point number three, the assessment question no one asks. As a nurse, I always go back to assessment first. Maybe you are depressed. Maybe you are anxious. Maybe. But what if the symptoms are being driven by workplace discrimination, workplace bullying, chronic understaffing, retaliation, impossible workloads, moral injury, the inclination to remain silent when you should be speaking out loudly about something? Shouldn't we assess that before assuming the problem is entirely inside you, before we assume and say that you have chemicals off balance in the brain and write you a prescription for depression? Point number four, SSRIs and SNRIs are not workplace interventions. Medication may absolutely have a place for so many individuals. I'm not anti medication, but antidepressants do not stop discrimination, do not stop retaliation, do not improve staffing, do not change toxic manager behavior, do not eliminate workplace conflict, do not give you the empowerment and encouragement that you need, but it will help you to tolerate abuse and not respond to the things that you should be responding to. My medical colleagues treat the symptoms, and those symptoms and the treatment for those symptoms do not change the workplace conditions. We want to help you change the workplace conditions. Point number five, common SSRs and SNRI side effects workers should understand. Before starting any medication, have an informed discussion with your provider. Commonly reported side effects can include nausea, sweating, headaches, fatigue, insomnia, emotional blunting, decreased libido, weight changes, dizziness, withdrawal symptoms when stopping. Oh, brain zaps. Have you heard someone discuss brain zaps after they quit taking SNRIs? I talked about my very own experience just the other day. I didn't mention the brain zaps, but I did mention some very important details that you should go back and listen to. Every medication carries risk, but not unless you know all of the language and all of what is happening. You cannot fully communicate to your doctor for him or her to decide that the risk outweighs the benefits. Ask questions. Point number six, the workforce care question. This question, I wish someone had asked me years ago. Wasn't what's wrong with you or what's the matter. The question is, what happened to you at work? And baby, I would have told them, I would have laid it all out. Him, them. Well, actually, I did try that, but you know what happened? I had to tell the psychiatrist that I actually had an attorney on retainer because it sounds delusional that these things are happening in the workplace today. So if your job is causing you symptoms that look like anxiety, depression, exhaustion, burnout, or emotional overwhelm, don't guess. Take the work fatigue quiz because not every symptomatic worker is mentally ill. Sometimes a worker is having a normal response to an adverse workplace. I'll leave the link below. Questions or comments, please make sure that you like and share this content. You may be saving someone who is dealing with workplace issues from going the wrong way. Have a great weekend. It's Friday, y'all.